Welcome back to my channel, my friends. There's not one video that goes by without a single comment, at least one asking on a health update. So it's been 6 months since I found out about my metastasized cancer, and I figure I'll give you a health update right now. It's just, to me, coming here and talking about it all the time, it just doesn't make sense because not a lot has changed. But I feel like from the time that I gave my announcement, if I will, about the cancer coming back, this has been a lot of changes in my meds and treatment and whatnot. So I feel like this is a good time to give you guys an update. So if you're new here, welcome, first of all. I do recommend you going back and watching my first video on this. I'll leave it down below so you know what's going on. Otherwise, you're not going to understand what this video is about. But let's get to it. Okay, I have my little cheat sheet in here just so I don't get sidetracked, because I had a comment from one reader on my Paris purchase. She's like, I enjoyed the video, but it's way too much talking. And she's so right, you guys. I talk so much. Apologies. First of all, you guys, I feel great. So I think that that's the most important thing to tell. This has been like a very easy journey to navigate. I'm just feeling really good, super energized. Also important to say that when I started this meds, which I think I gave an overview of what I was going to take on the first video, but I'm going to go over this again just in case. I did have some side effects. I had fatigue and hair loss and some other things, just smaller, and I'm going to get to them. But now, 6 months later, I feel really good. I wouldn't know I had cancer if it wasn't for my scans to tell me that I do have cancer. So that being said, I think a lot of it, not just the treatment, but also my attitude and just making a few small changes in my daily life have really helped. And obviously I cannot not mention my faith, because that's a huge part of my attitude and how I see life. And I'm just grateful for every single day that I'm here. And my biggest prayer, it's not even for God to remove this, but it's just that I can be as healthy as I can be. And if I need to die tomorrow, I want to die happy and healthy. Don't want to make this morbid, but this is kind of my feelings, and I just want to be real with you. So, and He wants to be with me when I'm wearing white. Aren't you funny? Yeah, you are. I have been traveling a lot, and I felt like my immune system was gonna like freak out eventually, and it hasn't. So I just wanted to mention this. I think this treatment has been really great and keeping me just perfectly the way that I am, like perfectly healthy. I just couldn't have asked for a better outcome of things. I do take some like supplements alongside with my meds, and I think that they do make a huge difference. So I do see a functional doctor, you guys know that, alongside with my oncologist. So she takes care of just my daily things of like inflammation, you know, like my vitamin D, like I have a good vitamin every day that I take, like pack. I do like, I take AG1 athletic greens. If you guys are not familiar with them, I see their ads all the time now that I've worked with them in the past, and I just love it. I figured out a concoction that works for me. I actually drink them with coconut water and a full lime in the morning, and it just tastes so good. I actually look forward to taking that in the morning. And other supplements too that I take prescribed by my functional doctor. I try to eat a healthy amount of like protein and lean protein, but I recently came across like eat right for your blood type of thing. I don't know if you guys are familiar with that, but I'm an O. I don't know if I'm O positive or negative, but O blood types are supposed to eat more red meat, and I've realized that I don't eat a lot of red meat anymore, and I'm trying to incorporate that a little bit more nowadays. I am drinking, even though one of the medications that I'm taking is hard on the liver. I am conscious of that, and I very much limit my amount of alcohol. I did quit drinking for a couple of years, 2 years to be more precise, and I felt great. Honestly, it's hard to tell you why I went back. I think I missed the social aspect of drinking because I was just ready to, whenever I wasn't drinking, we were out for dinner or whatnot with my husband or friends, I would just have my meal and enjoy the conversation, but I would be done. Like, I'm like, okay, I'm done. There's nothing else to talk about. And I think, unfortunately, that the drinking for me just carries on the conversation a little bit longer. And I enjoy that. So I had missed that a little bit. And that's the reason why I went back. But still very conscious drinking and very specific occasions, I should say. So that's kind of like how my diet has been. I try to eat more vegetables, more fruit, things that you find on the earth. I think they're great for you. I have bought a book, Cancer Free. I will leave the link down here too for you. I haven't read it all. Like I've gone through a few pages still, but I've noticed a lot of people saying carrot juice is great for cancer patients, as well as like so many other things. So I am trying to drink more cold pressed orange juice, or not orange, but carrot juice. And I upped my vitamin D intake. I used to take 5,000, whatever unit that is. And I'm now taking 10,000 just on my own. I haven't even checked in with my functional doctor, but this is one of the things that I read on the book. It's very specific, this book, and it guarantees that you will be cancer-free if you make those changes, which honestly, you guys, I think that we can really transform our lives by what we eat. I just want to register here. I do believe that I can get rid of everything just by the way that I eat. However, you can also add a lot of stress by thinking about what we eat. And I think that stress causes death more than cancer. And so if the changes bring you more stress than joy, then I'm choosing to make better decisions and better choices, but still not stress about having my treats. So that's just kind of my choice right there. As far as treatment goes, so I found out this in May, and then we found one of the spots was in my spine. I think I mentioned that. I honestly haven't watched that video and I don't remember what I covered in it. So I apologize if I'm being repetitive, but one of the sites was in my spine, and we did decide to do a radiation just because it was growing and I had a lot of numbness in my limbs, which is so interesting because they have diminished so much. And my oncologist felt like it was the cancer growing into my spinal cord, impressing my spinal cord, which is, there's so many nerves and neural transmitters in that spinal cord. Again, one more thing, I apologize if I'm mentioning or saying something wrong, medically wrong. I'm just trying to remember all the terms. And because of that, it's responsible for a lot of our movement and things like this. So, and also if the cancer gets into the spinal cord, so if the tumor was big enough that it would burst into the spinal cord, then it would be a much worse diagnosis because it would travel through other organs and it could get to my brain, lungs, you call it, you name it. It's just the possibilities of spreading to more serious sites would be very bad. So we did the radiation there just specifically to prevent that from happening. I don't feel any pain on my hips anymore. That was the original site when I actually found out I had metastasized bone cancer, was through my hip pain. No longer have that. I've been working out. I've been doing CrossFit, which is a very mild form of CrossFit here at my gym. So working on that. Still did yoga, hot yoga for a while. I haven't been to the studio in a month now due to travels, but that's just something that I enjoy doing. And I think it's just a really good way of moving my body. So recommend that, and recommend anything that's lifting weights, especially for women and the health of the bones. It's one of the things that's most recommended is lifting weights. And that's what CrossFit does too, in some ways. So been doing that, don't feel any pain. So we did 10 sessions. Actually, it was supposed to be 10 sessions of a certain amount, and we decided to just cut that short to 5 sessions, and he upped the dosage or double the dosage so I could finish that sooner, and didn't really have any side effects from it except for fatigue. I did have a little burn mark in here, but I used that Biafine from Paris, that cream that I swear by it. I buy every time I'm there, and it's just like it literally peeled off and it left no scar, nothing. It was amazing. So anyway, that was that. So for treatment, we did have the radiation, and then I have 4 different medications that I'm on right now. So 2 oral. One is letrozole. Letrozole is essentially a pill that I take daily. It's just a little yellow pill, and I'm not sure what this is for. I do know the other ones, but I don't know what this does. I should have. Anyway, you're not supposed to have any side effects from this, so it's pretty okay to take. And then Kisqali. Kisqali is essentially the brand name for the drug called ribociclib. Ribociclib is they call it chemo care. It's not chemotherapy, though it's like a targeted treatment, and it comes like birth control. So in a little pill case like this, there's 3 of them that come. It's 7 on each for 7 days. I'm sorry. And you take it for 3 weeks, and you take a break for 1 week. And I still take the letrozole every single day of the month, like forever. This one, when I started Kisqali or ribociclib, I started on the 3 pills. So 3 pills a day is the max dosage that the oncologist will prescribe. And he started me on the full dose right away. And then kind of like, let's just analyze and see how your body will react to it. And if, you know, if you're gonna react well, we stay with it. And if not, then we cut back the dosage. And one of the things that they look into when people are taking this drug is some of the blood cells. I want to say the right thing here. It's the low level of certain white blood cells that are responsible for the defense of the body, which means if they go lower than a certain amount, then you're super susceptible to get infections, which is not a good thing for any healthy human, let alone someone with cancer. So they don't want me to get sick. And we had to pay attention to those numbers closely. So when I started on the 3 pill, after a couple of months or maybe 3 months, my white blood cell count was super low, like below the lowest recommended, I guess. And so he then shortened or made my dosage 2 pills a day instead of 3. And you know, so far it's been really good. My body's holding up well. There is still 1 pill that we can take it out of the equation just in case I get other reactions or other side effects. But so far it's been 4 months of taking 2 and my body is pretty happy. The other thing I take is Xgeva. Xgeva is a bone strengthener and it's an injection. It's actually the most uncomfortable one. And I was taking that once a month. So every 4 weeks I would go and take that just right under my, it's actually still tender here, right under my, you know, where the skin is just a little loose here under the arm, the bicep area. And it stings, you guys. It's like a needle with little teeth in it. And the liquid is very stingy too. It's very uncomfortable. I'm a person who has high tolerance to pain, and that is just one shot that I absolutely hate. Just so you guys can have a little idea of what Xgeva does, it's like a super hardcore bone strengthener, and it's prescribed for women with osteoporosis. And women with osteoporosis take 2 shots of Xgeva a year. And a cancer patient that has cancer in the bones takes one every, I was taking one every month. So it's just a lot. But he wanted to make sure that my bones are like super, super strong. I'm not quite sure of the side effects. I don't think that there's a lot of side effects from Xgeva, except if I had to have some teeth work, meaning like root canal, some things that are like that the root of your tooth is exposed, then you can get infection and you can get like your jaw can rot. I'm trying to like find the words in here. So it's just pretty hardcore side effects. So once I actually broke a little piece of my filling, and I had to stop Xgeva for 6 weeks before I could see my dentist and make sure that this was not any work that needed to be done. Turned out it was just a little piece that it just needed to be repaired, so I didn't have to have any major teeth work. But people who are on Xgeva and have to have teeth work, they have to stop the medication because that's one of the big side effects. Now the overall goal we've talked about a month ago is for me to not see him every 12 weeks, but every 4 weeks, but go to 12 weeks. And he saw my scans and my blood work, and he was not super confident to let me cross over to the 12-week mark. So it just went from 4 weeks to 6 weeks. So instead of taking Xgeva every 4 weeks, I'm now taking Xgeva every 6 weeks, which it helps a lot. You guys, going to the doctor every 4 weeks is just a lot of work, and it's just a lot. And this is not a quick appointment. It's something that I go, I have to get blood work, I have to weigh myself, and then I have to wait, see the doctor, talk to him, which is usually he's backed up. So I'm sitting there for an hour before I see him. And then I go into the nurses and to get my shots, which is usually just the Xgeva every 4 weeks. So it's kind of a pain in the butt. And then one last medication that I'm on, which is a really important one, is the Lupron shot. The Lupron is essentially what brings me into menopause, or puts me into menopause. It shuts down temporarily my ovaries, and therefore the production of estrogen, which my original cancer diagnosis was estrogen positive cancer, breast cancer. So because there's a lot of estrogen in the women's body, and I was still not menopausal, they need to make sure that my body's not producing any estrogen, so the cancer it just eliminates one more source of growth for the cancer. So this is a really important thing. And also, in order for all of this medication to work on my body, my ovaries need to be shut down. So if someone who's going through this type of cancer, postmenopausal, they won't need Lupron shots, but if they are premenopausal, then they do need the Lupron shots. You know, the only side effects from that is the normal, like hot flashes, which I have a lot of them. However, I noticed that if I am drinking alcohol or eating spicy foods or things that like really accelerate my metabolism, is when I have the hot flashes really, really strong, or eating. But if I maintain like a better diet, they are not as frequent. So like I said, it's all in our hands, and yet we are so stubborn. We just want our treats. But anyway, that's the main thing with the Lupron. So the Lupron shots are every 12 weeks. So like I said, the goal is to be seeing, for the Xgeva to every 12 weeks. So that way I can, I can go 3 months without seeing my doctor and still keeping the treatment. Other than that, you guys, I think that's it. I just wanted to cover like the medication that I'm on. It is the 6-month mark right now, November 2023. I found this out in May 2023, right after my 5-year anniversary of breast cancer. So it was kind of a shock, but life is going on. I think I was just I don't want to say scared when I found that out, but it was shocking. And I'm just like, oh, this is kind of like a death sentence. And I no longer see things that way anymore. I do have in me that God can do all things. If you're a Christian, you're watching this, you know that already. However, it's his will and not mine. And so I submit to him once again, to what his will is for me. And it's his plans are better for me than anything that I can desire. And he's been blessing me in this journey and so beyond in so many different ways. So I have nothing but gratefulness in my heart. I am not gonna act like I'm sick because I don't feel like I'm sick. This is just something that's on the paper. And I'm going through the motions. I'm not crazy and like, oh, I'm not gonna do treatment. Maybe I will eventually go that route, but right now I'm following a doctor's orders and I'm trying to stay as healthy as possible, moving my body and just keep at it. I think one of the things I wrote here too is like, yeah, I was gonna touch base on some of the side effects for Kisqali, the ribociclib drug, and I did have the fatigue and the hair loss. Mood and mental changes are another piece of this puzzle too. And I went through all of them, and one of the decisions that I made to cut my hair was because I was losing hair like crazy, you guys, just crazy. And it says either hair loss or hair thinning, which I've always been very blessed with a lot of hair, or cursed, you know, because I felt cursed sometimes, but now I know it's a blessing. And I'm super happy that I cut it short, and I feel like it's stronger now. So it's like whatever side effects that I had in the beginning, I feel they're much, much more mild right now. And quite frankly, if this is all that is to this diagnosis, then I'm like super, super lucky. Anyway, that's it for today, you guys. Don't want to be chit-chatting here too much more, but just wanted to give you guys this health update. Thank you so much for your concern and thinking about me and always asking. It means a lot to me. I'm sorry I don't always respond, but I always see it and I'm like, it's in the back of my mind. It's on the to-do list. I need to give them an update. So with that said, I probably won't give any more updates unless something major happens, unless, you know, there's a turn for the best or for the worse, then I will come back. But other than that, I think we're going to continue with this treatment for a while. And we'll see how it goes. Maybe I'll give you a 5-year update or a 3-year update. I don't know. You tell me what you want. And until next time, thank you so much for watching. Um beijo. Bye bye.